Hi there. Welcome to Afro Perspectives. The collapse of the public health system in Zimbabwe and the looting of public funds meant for the country's public hospitals and clinics by the country's politicians. This is the reality of life in Zimbabwe. On a daily basis, we are confronted with pictures of the desperate plight of ordinary Zimbabweans trying to access healthcare in a collapsed public health system. We are witnessing patients sleeping in corridors in the country's largest public hospitals. Even where the beds are there, they are just of such poor quality that there are no bed sheets. Nothing but just bare mattresses. Patients are stripped of their dignity under such a system. We see ambulances collecting rust in hospital parking areas because there are no spare parts to repair their vehicles. In the rural areas, the marginalized and the poor use ox-drawn cars to get the sick to hospital. Nurses cannot maintain basic hygiene because the hospitals have run out of ordinary soap. Besides the lack of basics such as ordinary painkillers, this is how desperate the situation has become. Consider a piece of string. Doctors call them sutures. They cost an average of $3, and even those they are not available in the country's public hospitals. And then we have stories of patients bringing up their own food to hospitals because the hospital itself cannot manage to feed patients. It's now a regular occurrence at the major referral hospitals such as Harare's Parienyato Hospital and Bulawayo's Mpilo Hospital to cancel operations because there is no anesthetic to keep patients pain-free during operations. In that document you see online on there, which I've loaded up on there, they are talking of an elective list, and that is just a doctor's language for an operation. Even if where the treatment is there, the number of patients and what is available does not simply match. Consider Parienyato Hospital, the country's biggest referral hospital located in Harare. It has just one dialysis machine and can save only 12 patients a day. For those lucky enough to have savings, they have to pay $3,000 for a single session of dialysis in one of the country's private hospitals. When you consider that a patient needs 4 sessions of dialysis a week, then you wonder where does one gets $1,200 per week. And this is in a country where there is 95% unemployment, and most of those who formerly held jobs are now scratching a living as vendors. Zimbabwe is not a poor country, at least by African standard. It is rich in deposits of strategic minerals such as gold, platinum, and diamonds. Consider that last year in 2024, Zimbabwe got nearly 3 billion from the sale of minerals alone. So where is all the money going? In Southern Africa, Zimbabwe is regarded as one of the most corrupt countries. This is not surprising. In 2015, former President Robert Mugabe's government could not account for a cool $15 billion in diamond revenues. In 2024, Zimbabwe is in the top 10 most corrupt countries in Africa. Of course, there are countries like Somalia, Sudan, and Libya who are fighting wars. But then in Zimbabwe is not at war. So what does the government itself has to blame for having such high levels of corruption? Of course, it's the country's thieving political elites who are pilfering public resources. The political elite in Zimbabwe live a champagne lifestyle. They buy expensive properties in offshore locations such as Dubai. Public funds are looted through a shoddy public procurement system. Zimbabwe is awash with briefcase businessmen who rely solely on securing tenders from the country's public procurement body, and then they never deliver on those contracts. One such guy is a friend of the president who is known as Wikulne Uchiwayo. He calls himself Sir. He has got hundreds of millions in US dollars and has never delivered on a single project. Most of the money Zimbabwe needs to pay for treatment in public hospitals is there. It is just that the elite are looting public funds. In the last year alone, 2024, Zimbabwe lost nearly 2 billion US dollars to corruption. Consider this: in 2001, the African Union, in a meeting in Abuja, health ministers agreed that for an average African country, it has to spend at least 15% of the national budget on health. In 2024, Zimbabwe allocated close to 785 million US dollars to its public health sector. This is just 10% of the national budget, way below the 15% target recommended under the Abuja Declaration. Lack of resources at the national level translate into poor remuneration for healthcare workers. There are stories of nurses with over 10 years of experience taking home the equivalent of just 150 US dollars per month, and junior doctors are paid roughly the same amount a month. Most nurses moonlight as vendors during the day and only work a few hours in their day job as nurses. The net result is poor morale and low standards of care for patients. Strikes for better pay are a regular occurrence, and the government simply ignores the requests for better pay. The collapse of public hospitals is shouldered by Zimbabwe's neighbors and the rest of ordinary Zimbabweans. In the border town of Beitbridge, near South Africa, pregnant women have been crossing the border to attend the maternity unit at Msina Hospital. Then in the north of Zimbabwe, people are flocking into Zambia. With 4 million more people than Zimbabwe, Zambia offers free primary health care services, including basic treatment, preventative care, vaccinations, and even maternity care. Even though in Zimbabwe access to health care is supposed to be a constitutional right, mismanagement of resources and the shoddy state of hospitals has emptied that right of any meaning. It's now only a symbolic right. Zimbabwe has only one medical school. It produces 100 medical doctors a year. Most of these medical doctors have left for other English-speaking countries such as South Africa and the United Kingdom in search of better pay and better working conditions. And then in 2024, 21,000 of nurses left the country, and most of them ended up working in the United Kingdom. The exodus of medical professionals to greener pastures abroad is already making a bad situation even worse. Zimbabwe has just one doctor saving 10,000 people. The World Health Organization recommends that one single doctor should look after at least 1,000 people. It's not just that a country like Zimbabwe needs an insane amount of resources to achieve this. It's just a question of getting the country's priorities right and allocating the resources it has as a country in a transparent manner. Consider Cuba. It has 8 doctors saving 1,000 people, and this is a country that allocated most of its resources to saving the healthcare needs of its people, and it's just a developed country just like Zimbabwe. So you see, it's not simply a question of resources, it's the willingness of the politicians to commit themselves to the country's, to their fellow citizens' needs. Thank you so much for taking time to listen to this. If there is anything that I have got wrong or that I have not mentioned, please drop your comments in the box below. Thank you. Bye.